Good day, our dear parents. It is a pleasure to welcome you to our Cosmic Day. This day is an event where we research, present scientific facts, experiments or demonstrations. It is a day for each child to showcase what they have learned within the topic of discussion. This year, Madagascar school is entirely looking at the human body.
The human body is scientifically defined as a complex composed of living cells and extracellular materials. These materials are organized into tissues, organs, and systems. This year, we are focusing on the structure of the human body, including the arrangement and locations of different parts.
These systems are all grouped according to their classes. For example, the integumentary system. These are skin, hair, and nails that regulate body temperature and provide protection to the body. We have the muscular system. These are muscles that maintain movement and posture of the body. The nervous system on the other side, it coordinates body functions, and those are the brain, the spinal cord, and the nerves.
We also have the circulatory system. These are heart and blood vessels that transport blood and nutrients. The kidneys, bladder, and liver are responsible for filtering waste and regulating fluid balance. Lastly, we have the reproductive system that aids in hormone production. You are welcome to the show. We are going to group ourselves and move around with the guides.
My name is Carly Daya, and I'm here to guide for today. And I'm going to take you through the classes. You may follow me.
Wonderful time again to have you, our dear parents. Welcome to P5 Alex Cosmic Promo. Our topic of discussion this year is the skeletal system. In the very first place, let me introduce to you the meaning of skeletal system. Skeletal system is a body system made up with many bones that actually help in some body activities. At this point, allow me to invite Ethan to tell us what is on his desk.
Oh yes, thank you so much. On my desk, I'm going to take you through the skeletal system that includes the skull. The skull is used to protect the brain. It also protects the eyes and the nose.
Another one is the limbs, consisting of legs and hands. You have the chest that has sternum.
The human skeleton has also its own components beside bones, and they include cartilages, which cushion bones, and they also reduce friction between bones. Cartilages are soft and are found at the end of every bone, like the nose and the trachea. These are connective tissues, tendons. These structures connect bones to muscles or vice versa.
Thank you, Dr. Ramadan. I'll now continue from where I left off. Ligaments. These are connective tissues that connect bones to other bones. Then we have joints. This is a place where bones meet in the body. In approximate measure, we have more than 365 joints in the body. Mentioning a few ball and socket joints found at the hip and the shoulder, hinge joints found at the elbow and the knee. All these joints enable us to move.
Away from that, our dear parents, let's now budge into some of the functions of the human skeleton. The bones provide support to the body. The human skeleton helps the body to move from one test to another. The ribs protect the heart and the lungs from external damage. The skull, on the other hand, also protects the brain, a vital organ for many functions like vision.
Thank you, Dr. Paul, for the opportunity. My name is Dr. Rotomara Alan, and I'm talking about bone marrows. Bone marrows found inside the bones, helping the manufacture of cells. For instance, white blood cells. White blood cells are formed in the long bones, as red blood cells are formed in the short bones.
At this event, we really want to let you know the number of bones found in the body. At first, when babies are born, they tend to have more bones, reaching up to more than 300 bones in the whole body. But later, when they grow up, their cartilages join to become bone, resulting to 206 bones in the whole body. Other misconceptions about ribs: that women have more ribs than men. There is no anatomy in science. Women and men have 24 ribs in total. Breaking a few, there are 22 bones in the skull, 33 bones in the spinal cord or backbone, 30 bones in the legs, and so on.
Yes, let's get into things the bone is made of. These include blood cells, nerves, and mineral salts. Some of the nutrients that harden and strengthen our bones. These include calcium, phosphorus, and vitamin D. One can just sunbathe and get radiant heat, which provides vitamin D. Another can eat green leaf vegetables and mukene to get calcium, which makes our bones strong and hard to break.
Now let's look at the types of bones as they are derived from their appearance. The first ones are long bones. These are found in the limbs or legs and hands. Their bone marrow is yellow in color. As my friend said, these long bones include femur. It is also called the thigh bone. It is the longest and hardest bone in the body. Another one is the fibula and tibia located at the legs. We have numerous running from the shoulder to the elbow, and then the ulna running from the elbow to the wrist.
Other type of bones are the short bones. They are found in the hands, feet, and the human ears. They have a red bone marrow which forms red blood cells. They include carpals, metacarpals, tarsals, metatarsals, and phalanges.
The human ear also has ossicles, which are a group of bones that amplify sound when hearing. They include hammer, anvil, and stirrup. The stirrup or steps are the shortest bones in the body.
The other type of bones are flat bones, which include the skull, the scapula or shoulder blade, the pelvis or hip bones which protect the reproductive system, and the kidneys which help to filter blood in the body. The sternum or breastbone is a flat bone separating the chest in the middle. Then also the ribs or rib cage, which are held in position by the intercostal muscles.
The last types of bones are irregular bones. Irregular bones have no shape, including the neck vertebra found at the neck. The backbone also has an irregular shape which protects the spinal cord.
The kneecap found on the knee, it is called tendon.
Appearance. Bones, just like other body organs, have diseases and disorders that affect the way they perform their work. These conditions include polio, a very immunizable disease that majorly attacks children who are not immunized at birth, and other doses at 6 weeks, 10 weeks, and 14 weeks in polio vaccine. What should the person has polio? The legs are lame and use a crutch when walking. The lips are parallel, straight, and can't bend.
Other diseases of the bones include leprosy, which destroys the tarsals and the metatarsals, making the toes shorter than usual. Bone cancer, caused due to environmental factors like exposure to X-ray for long and inheritance for parents. Then there are bone disease, tuberculosis, spread from lung to bones if not treated as early as possible. At this point, Eddie Chene is my name, and I'm here to inform you about the disorders of the bones. One of these is a fracture. This is when bones break from the body. Others may break and remain inside, and others may break and damage the skin. Some of the types of fractures are simple fracture and compound fracture. Simple fracture is when the bone breaks and stays inside the skin, while compound fracture is when the bone breaks and comes out of the skin. Fractures can be caused by accidents like falling off tall buildings, trees, and mountains. Another one is the sprain. It can be caused by the ligament overstretching or tearing in the body. Another one is the strain. This is when the tendon overstretches or tears in the body, resulting to pain. Sprains and strains can be got when one does vigorous exercises and stepping in ditches. Dislocation. It is too painful because the bone moves away from its normal position. As we come into conclusion of the bones and the skeletal system discussion, we would like to give a few health tips that help the bones and the skeletal system to be healthy and strong. One of them is having good posture or sitting upright to prevent bent backs, among others. taking children for immunization using polio vaccine, BCG vaccine, and TT vaccine, taking all girls at childbearing age and expectant mothers for immunization using TT vaccine. All doctors and nurses should sterilize surgical blades before cutting the umbilical cord of a baby to protect them from tetanus. Avoid carrying things that outweigh us as they may damage our bones. Feeding on a balanced diet to keep the bones healthy and strong. Warming up before performing simple exercises, going to work or playing. Don't hesitate to visit the orthopedic doctor.
Our parents, kindly relax. This topic is not yet over. Another section is the muscular system. The muscles are simply bundles of elastic flesh in the body. Also, the muscles are very many in the body, reaching beyond 600 in an estimation. Now at this event peak, allow me roll you down to Roland to tell us more.
As the MCI said it, muscles are attached to bones by tendons. At this point, we shall look at different characteristics of muscles, one of them being contraction and relaxation. To contract means the muscles become tight or hard, commonly the cabote, and to relax means the muscles become loose. This contraction and relaxation of muscles enables people to do work. Other characteristics of muscles include containing cells and they are made of proteins. You may get some other info from my fellow colleague M.
At this point, muscles just like bones have types. Let's get started. The first types are voluntary muscles. For these muscles, their movement or action is controlled by one's brain. Meaning, if you want your muscles to relax and contract, you either bend or straighten your arm. The best examples are biceps and tricep muscles, surrounding the humerus bones. I would also like to let you know that biceps and tricep muscles work antagonistically, meaning they work in pairs but opposite effects on each other.
This actually means that when I bend or straighten my forearm, the biceps contract and the triceps relax. Another one is when I straighten my forearm, my biceps contract and the triceps relax. And if biceps contract and triceps relax, that will cause the movement in the body. Wow, without a waste of time, let me talk about some of the characteristics of voluntary muscles. They are fibrous, meaning they have a flesh that is packed, and this makes them strong and tight. Even if these muscles have a flesh packed in bundles, they get tired quickly. Instance, if one does a lot of carrying, one may become weak. Other types of muscles in the body are the involuntary muscles. For the involuntary muscles, their movements or actions are not controlled by the brain, meaning they can contract and relax without involving the brain. These muscles can work throughout for long, 24/7 without getting tired. Examples of such muscles: muscles of the heart or cardiac muscles. Other examples of muscles are involuntary muscles, which include the intercostal muscles that hold the ribs in position during breathing. Another one are the muscles of the iris that always allow a pupil to adjust and receive light. Another one are the stomach walls that always churn food into chyme. These are the functions of the muscles in the body. The uterine muscles help to contract and help the woman to push the baby out during delivery at theaters. Cardiac muscles help the heart to pump blood to all body parts. Muscles contract and relax to cause body movement. Sphincter muscles help to control the flow of urine from the bladder. Babies always urinate on beddings and themselves because their sphincter muscles are weak to hold urine for long. Diaphragm muscles help in breathing. Muscles store fats that generate heat to keep our bodies warm. Thank you, our dear parents, for sacrificing your time for us. May God bless you. Bye. Welcome, our dear parents. This is P6 Gloria. Last year, we looked at food preservation and processing from our previous class. This time, we are wrapping up the entire cosmic research from all classes, right from baby class Melman to P5 Alex, and we are looking at the whole body formation from conception, pregnancy, and all stages involved before these are formed.
Thank you so much, Jaden. Let us begin with Priscilla. Priscilla, what is reproduction?
Reproduction is the process by which living things multiply by giving rise to offspring. Dear parents, we shall now look at the different stages in reproduction. The first stage is ovulation. This is the time when the ovary releases a mature ovum that is fertilized by the sperm to form a zygote that then becomes a fetus that develops into a baby.
Thank you so much, Priscilla. Sheena, do we have conditions that are necessary for fertilization to take place?
Well, fertilization is the union of a male and a female gamete to form a zygote. For fertilization to take place, there are some conditions that are necessary for fertilization to take place, e.g., correct timing, location, and health of both the egg and the sperm. If all the conditions are favorable, then fertilization takes place successfully.
Queen, can you tell us what happens during fertilization?
During the first stage, a woman's body goes through a lot of changes due to the numerous hormones present, and in the process of a complete body formation, the human body has got 3 growth stage layers.
Emmy, tell us more about the first layer.
The first layer becomes the nervous system and the brain. Just like top class discussed, it will immediately be followed by the second layer that will form the digestive system and the lungs.
Okelo, please can you conclude?
Finally, the third and the last layer will be formed, which will consist of the blood system, the heart, the skeleton, just like primary 5 Alex discussed in the presentation.
Mahad, what happens after the body organs have been formed?
The unborn child is nurtured into 3 stages. The first stage is the first trimester. This is the period between 1 to 3 months.
Reina, what is that period about?
Well, this period is very challenging for mothers because many experiences various symptoms such as nausea, fatigue, breast tenderness, frequent fever, dizziness, loss of appetite, and general morning sicknesses.
Gina, take us through the second trimester.
In the second trimester, the baby's bones are hardening, skin is thickening, soreness are formed, the nervous system begins developing, hearing start develop, and the baby can open and close their eyelids.
Caro, tell us more about the third trimester.
At the third trimester, you will be able to see the gender of the baby. In this stage, the baby's growth response is affected so much by the food the mother eats, the lifestyle she takes on, and emotional status of the mother too. Thank you.
Welcome to this group, parents. Patricia, what are you talking about in your group?
Much as the body organs and hormones are meant to create, multiply, and make more lives, there are various challenges that affect these hormones, making them to become dormant or permanently docile. In our research, we are looking at infertility in both male and female.
Ruby, can you define infertility?
Infertility is the inability to conceive after a year or more of regular and protected intercourse between a couple. In most cases, infertility is so much attached to women, and it's always believed that women are responsible for lack of babies in marriages. Well, today we shall break the barrier through our research.
Well, there are many factors that can be hereditary, scientific, emotional, or physical that can cause delay in conception.
Well, hereditary means factors that can be got from our parents. Scientific can be caused by technology like radiation, sauna effects, use of drugs, and many others. Physical or emotional can be caused by accidents, stress, or abuse directly on the body.
Adrian, how do you feel about this topic?
This topic is so interesting because it helps us learn more about our body, especially our mothers who could be wondering why they experience delays during conceiving. Patience, take us through.
I am talking about delay in conception or infertility in women. According to research, over 48 million women are affected globally, with the highest prevalence in South Asia, Sub-Saharan Africa, North Africa, Middle East, and Central Europe.
The main factors that can put you at high risk of infertility, especially in age, reproduction gap, can be
damaged or blocked fallopian tubes.
What are damaged or blocked fallopian tubes?
Damaged or blocked fallopian tubes are reproductive tubes that have been affected by infections like STDs, STIs, and surgery, causing scars or cobweb-like blockages that do not permit the sperms to pass through and fertilize the eggs.
Let me take from her as I talk about damaged fallopian tubes. This is the sac or organ that transports ovaries to the uterus to facilitate fertilization. They are essential for female reproductive organs.
Chris, what causes damaged or blocked fallopian tubes?
Damaged or blocked fallopian tubes can be caused by a variety of factors like pelvic infestation, often caused by sexually transmitted diseases like gonorrhea, most especially in an area of a girl.
How does that affect fertilization?
Blocked fallopian tubes prevent fertilization in two main ways. Firstly, by preventing the sperm from reaching the egg. How? This is because of a lot of dirt and scars on the walls of the tubes. And when a sperm is traveling to meet and fertilize an egg, there will be a lot of dirt that may act as a roadblock by contaminating the sperm, hence it dies there and then. Inflammation is caused by bacteria called Nursery gonorrhea.
How does that affect men, Josh?
In men, gonorrhea can damage the testicles, causing poor sperm production and sometimes low sperm count. That will not be able for a man to fertilize any egg, no matter how much a man tries. Thank you.
Christine, are there some lifestyles that can cause infertility?
Yes, lifestyle like smoking, sauna, and swim bath. Too much workout in the gym and excessive consumption of alcohol can as well cause infertility. Sitting for too long while driving can also well cause infertility.
Munira, how can we help women who are infertile to conceive and have their children?
Infertility in women is treated based on the underlying cause of options ranging from medication and surgery to more advanced techniques like intrauterine insemination and assisted reproductive technologies like in vitro fertilization in men lifestyle.
Thank you so much, Munira's group, for looking at infertility causes and treatment.
In this group, we are looking at birth defects, hormone imbalance, and abnormalities.
Elisha, what are hormones?
Hormones are chemical substances produced by the glands in the endocrine system and released into the bloodstream during different stages of growth.
If these hormones are needed, how does it cause imbalance?
In some women, the hormones are either too much or less, hence failing to meet the body's needs, which will become out of sync for the body.
If all those changes take place during the human growth, as Ali said, the hormones will fail to balance, then you see the abnormalities like heart defects, urotube defects, cleft lip or palate. The clip of the palate, this is a split in the lip or roof of the mouth.
Evanji, what are you talking about?
I am talking about neurotube defects.
What are neurotube defects?
Neurotube defects are effects of the development of the brain and the spinal cord. For example, spinal bifida. This means there is an abnormal external growth from the spinal cord at the back of the head. It's a type of neurotubal defects. This is to say that during of the development of the brain at the third week of the pregnancy, the spine remains closed instead of open.
Bridget, what abnormalities are you talking about?
I am talking about limb abnormalities.
What are they?
Limb abnormalities is yet another abnormality which can range from missing limbs to extra fingers or clubfoot. Lastly, have Down syndrome, which is caused by availability of COP chromosomes 21. With these few examples, we can now send you to the next group.
Hezron, on your side, what are you looking at?
On our side, we are looking at how to feed, protect our body organs healthy. God designed us in form of shapes, and our bodies are represented by certain fruits we have in our class.
Kyle, what advice can you give to mothers for clear skin?
For clear skin, you can consider taking orange juice mixed with lime, beetroot, and if you want to detox the entire digestive system, you can consider taking beetroot, carrot, and lime. Thank you.
The discussion has been long, but we are glad that you have been able to stand with us till now. Now, we all know something little more about fertility, fertilization, growth and body development. Safe journey as you travel back home. See you then.